When we look at urinary stone disease, we typically have used 24-hour urines to look at constituents that are responsible for stones, including urinary calcium, urinary uric acid, urinary oxalate, urinary citrate, pH, and total volume. Despite all these studies, a third of all stone formers will have normal 24-hour urine constituents. We appreciate that stones may reflect more than constituents in the urine, and we have done studies in a variety of mechanisms to try to look at this association between urinary stones and heart disease. We've done that on a variety of fronts. First, we looked at the study of osteoporotic fractures, and this is a study looking at women with looking at the impact on bone disease. We found a subset of these women who had stone disease and found that in the study of osteoporotic fractures, there's about a 16% increased likelihood of having a heart attack in those that had stones versus those that did not have stones. We initially looked at the healthcare professional study from Boston and found that the prevalence of cardiovascular disease, such as heart disease and the need for having coronary revascularization, like a stent or a coronary artery bypass graft, substantially and statistically increased in those with stones versus those without stones. We then looked at women in the study of osteoporotic fractures and found similar instances in the prevalence of heart disease in the format of congestive heart failure and myocardial infarction. More recently, we looked at the Cardia database, and we found that people followed over a longitudinal period of time that those that had stones had an increased likelihood of having calcifications in their coronary arteries, and we also found some pathology in the carotid artery, giving very good epidemiological evidence that urinary stones is a systemic disease, goes beyond the urinary system, and has an impact on our cardiovascular health. As such, intervention is required in patients who have urinary stone disease.